Hello and welcome to our webinar where we'll be discussing substance misuse prevention approaches. My name is BC Echohawk and I'm a member of the Pawnee Nation of Oklahoma. On behalf of the Native Connections team and Contracting Officer Representative Maureen Madison and Jan Dunbar Cooper, thank you for joining us today. GTA's Deborah Rattler and Sienna Hunter-Cujay will be facilitating our presentation with Wayan Moon Smith to discuss how substance misuse prevention approaches can be used in your community. Please feel free to share your thoughts and comments either through the chat box or by raising your hand. Deborah?
Hi. Today for this webinar, we have a trigger warning and a few words about self-care. We just wanted to really advise you that this webinar is going to include discussions on substance misuse, which can be sensitive or triggering for some viewers. And we do recognize that, again, please take care of yourself. And self-care is an essential practice for the work we do today. So after this webinar, during this webinar, if you do need to take a few moments away, please do that, But again, we are looking forward to sharing this information with you. Well, good morning and good afternoon, everybody. Welcome today. My name is Deborah Rattler. I'm from the Gros Ventre tribe of North Central Montana. I'm going to be a moderator today, but I'm going to be in the background kind of monitoring the chat box. And so at this time, I would like to hand this over to Sienna and Wayan. Thank you.
Good morning and good afternoon to everyone. My name is Sienna Hunter-Cujay. I am from the Shinnecock Nation out on the eastern end of Long Island. I serve as one of the supervisors on the Native Connection grant. I'm also a technical assistant coordinator, and I provide a lot of support across Indian country. And so I'm really excited to be here with you all today to speak about opioids and to provide some, support and information. But I'm really excited to be here with my relative, and I will pass it over to him.
Hello, relatives. Good day. My name is Wayan, aka Moon. I come from the Shinnecock Nation as well. And I'm a person in long-term recovery. And for me, that means I haven't had a mind-altering substance in 7 years, 2 months, and 1 day today, right? I'm super excited to be here with each and every one of you. I actually see some familiar names on this webinar. So now I'm nervous, right? So I see some familiar names here, but I'm super grateful to be here. My day job is I'm a associate director of peer services at Center for Recovery Center. Also a certified peer support worker here in New Mexico, as well as a licensed substance abuse associate. Although I am from New York, Shinnecock, I do reside here in New Mexico because my sobriety, my recovery journey has allowed me to come back here to be a full-time father. And so I say to Bootnish, to each and every one of you for being here today. And I am looking forward to, having this amazing conversation. And that's what I hope we have is a conversation. Next slide, please. So why are we here? I want you guys to take a moment, right? Take a moment, and in the chat, if you can just put something in there of why you think you are here, and also what are some things that you might want to learn today. So we're going to take a couple moments, just go ahead and put it in the chat, why you think we're here, and also what would you like to learn today? And then we can read off some of those answers, and then we'll keep it going. Then maybe I had to start calling some names out, because I see some people on here I know.
I don't know, maybe some folks haven't had their coffee yet today. Well, we want to make this as engaging as possible, but that only works if you all will participate with us. Well, thank you, Elwood.
There we go. To learn more, I'm here for tips on how to create messaging that resonates in Indian country and youth. Nice. Opioid. Yes. Here we go. Now you guys waking up.
And BC has to be here.
I hear you, BC. Nice. All right. So I'll take that. We do have some. There we go. Now they're coming
Mhm.
in. Strategies for reaching youth about staying on a healthy path. Absolutely, Julie. Thank you for sharing that. I think that's going to be a huge focal point on this presentation. Interchange for nice. Yes. Opioid use among youth risk and protective factors. Absolutely. Oh, protective factors. That's a huge one. Okay, Chinook, I see you. What's up, Chinook? All right, great. Thank you guys. Thank you guys for taking your time and giving us some some feedback. Next slide, please. Okay, so some of our objectives are going to be to provide a brief overview of opioids and opiates, present information in the state of opioid crisis in Indian country, right? So what does it look like for us in Indian country? How are opioids affecting us in Indian country? Provide information, excuse me, about the consequences of opioid use. Provide information on, excuse me, promising community responses, review how we can address the use in the workplace, and also community resources. A huge one, community resources, right? Being familiar with all the different resources that are in your community. I think that is huge. Just being in the field that I work in, it's instrumental that I know many different resources throughout the community because especially working in rural communities that have limited access, how do we overcome that in rural communities? Next slide. All right, so I wanted to take a moment here and just talk to you about this image. This is the image that I have chosen, and it has relevance to my recovery journey, right? So this picture comes from the Haudenosaunee people, way upstate New York in Canada. And it says here, enough is enough. Stop heroin and opiates, right? But why did I choose this? I'm from Shinnecock, so why did I choose this picture that comes from my relatives up north? And the reason why is because, I started my sobriety journey probably about 8 years ago, and I said that I have 7 years of recovery. So I had, I had a relapse and I had a setback, right? But I really started my journey in Akwesasne, at a place called the Partridge House. And I gotten to be really close with that community. So much so that the counselor who was my counselor while I was in treatment there, we have came back together. And actually tonight, Tuesday night, 6 o'clock Mountain Time, we will be doing our talking circle. And I've been doing this talking circle with him for the past 5 years. For the past 5 years, every Tuesday night, we've been doing this talking circle. And he was my counselor at the Partridge House, at that treatment center. And everything has come full circle to now we are actually working together, healing, right? And I want to share this term that I learned from them. Excuse me. He says, Gunalunkwa. And what that means is that I share my medicine with you. And I think that sums up why I'm here and why I do the work that I do. It's because someone shared their medicine with me. Someone shared their experience and their hope with me, right? And so my job is to now help someone else and pay that forward. Gunalunkwa, share my medicine with others. And so I just want to share that and the importance of that image there and how important the Haudenosaunee people are in my life. So I'm gonna go ahead and turn it over to Sienna.
Thanks, ma'am. So one of the things I know that some of you may have this information already, but we always like to give a base of information. So we're all starting at the same point of our knowledge. And a lot of folks will ask the question about, well, what is the difference between opiates and opioids? Isn't it the same thing? And when we look at opioids, we're really looking at the derived from the opium poppy plant and is classified as a Narcan. opioids is really referring to like all of the natural, semi-synthetic, and then the synthetic opioids. So what is made in a lab. And so that's why you could see them interchanged, but there is a difference between the two. Next slide. So how do opioids and opioid use work? What does it look like? It does depress the activity of the central nervous system, which helps reduce pain. A lot of folks will talk about when they take an opioid that it makes them feel sleepy or drowsy or really relaxed. It can produce feelings of pleasure, and that's part of your brain, your reward system brain, that lights up, and that's why people are very addictive to an opioid, because they feel good taking it. And then it can also produce severe withdrawal symptoms, such as nausea, vomiting. We do see high rates of overdose and death related to opioid use. And again, this is something that really triggers that central nervous system of our brain, and it's really a powerful drug that's out there. So some of our commonly prescribed opioids and opioids, oxycodone, hydrocodone, also known as Vicodin, oxymorphine, codeine and morphine, those are probably the two that most people know about, or are prescribed after a surgery or some kind of medical procedure. Morphine you usually get in the hospital. Tramadol is another one, and then fentanyl. We will kind of focus a lot today on looking at fentanyl, and then some of the street drugs. Go to the next slide.
All right, y'all. So I got a question. Just give me a virtual hand raise, right? How many of you have ever been prescribed an opiate? Talk a little bit about what they are, the different prescription pills, prescription opioids. How many of you guys have been subscribed that? Right, a lot of us. Okay, great. Thank you. So what I want to talk to you is about the danger, right? The danger of opioids when they're not prescribed, right? Because some of us, like my son just had his tooth pulled, you know what I mean? He wasn't prescribed anything, but he could have been, right? And there's a difference between real opioids and real pills and then what we call fake pills, right? So the pills that are highlighted in the green, those are real pills. It's real oxycodone, it's real Xanax, it's real Adderall, right? But say this is how, some of the opioid epidemic started, right? We were prescribed these legitimately. We went to a physician, right? We were prescribed, we were told how to take them. We were told to take them one every 4 hours, every 6 hours, and we followed the rules, or maybe we didn't follow the rules, right? But this is what happens. Because these are so addictive, right? Some people may have had the challenge of becoming addicted, right, to these pills. And they ran out their prescription, their legitimate prescription that they received. And so then what happens? They go back to their doctor, and the doctor's no longer going to prescribe them prescription opioids. They gave it to them, that was it. But they're addicted already. So then they turn to the street. And these pills that are highlighted in the red, they look exactly the same. I can't see too much of a difference between the real and the fake pills, right? But there's one huge difference. You see, those fake pills are laced with fentanyl. And that's where the danger comes in, right? We're going to talk about fentanyl as we go throughout this presentation, but fentanyl is extremely powerful and extremely deadly and extremely addictive. And they're laced without even knowing. Right? Without even knowing. And there are ways to get around that. Right? There are ways to find out if if the opioid is laced with fentanyl. There are what they call fentanyl test kits, right? But I want to share this story about just how dangerous of us getting prescription pills off of the street. And one of those dangers are is that we had a relative who passed away about 8, 9 years ago. And it was because he had chosen to smoke some marijuana. And that marijuana was laced with fentanyl. And he did not wake up. We lost him. And the reason why I'm sharing this is because this is what these fake pills are laced with. But fentanyl's everywhere now. It's in every drug right now, right? And so part of this presentation too is also talking about harm reduction, right? And one of the ways that there is a harm reduction practice with fentanyl test strips to where you're able to actually test the substance that you're using to see if it is laced with fentanyl. And what I mean by that, say someone is their drug of choice is cocaine, right? But because fentanyl is being put into all drugs now, that fentanyl test strip will be able to see if that cocaine is actually laced with fentanyl. And maybe then that person would not take that and possibly experience an overdose. Sounds crazy, right? Sounds like I'm promoting the use of drugs, but I'm not. I'm talking about saving lives. Because see, my job is to save someone's life. My job is to give somebody every opportunity to get well if they choose. And we can only do that by keeping them alive. You guys see Anna?
That opportunity to get some recovery. So we'll head to the next slide. So this is just kind of an overview of looking at what is kind of controlled in the sense of legislation and law, what's regulated in pharmacies versus what is on the outskirts. So looking at heroin, and that is something that is not controlled within a pharmaceutical framework. And again, speaking to what Leon was saying about stuff on the streets, and it's really dangerous to look at the things on the streets. We'll go to the next slide, so then we could talk about heroin. Heroin is part of the opioid family. It's typically made from morphine. You could find it as a powder or like a sticky substance. This can be inhaled, it could be injected, it could be smoked. You see high rates of dependence with heroin. You see high rates of overdose, death, and other medically related conditions. And when we look at other medically related conditions, very often when someone is actively using, they're not taking care of their other activities of daily living, going to the doctor regularly, good eating habits. And if you go back to the next slide, the previous slide, sorry, moving too quick. Thank you. Being able to, look at all those areas of everyone's like daily life that are being forgotten about. One of the other things too about heroin is very often someone will start off with the pain pill, as Wan was alluding to earlier, and it may start off with Vicodin. They find that they really like that Vicodin, and they're starting to snatch pills from family members, going into medicine cabinets, and kids will have farming parties, and so they'll take pills out of the medicine cabinets and drop it in a bowl and mix it up and just pop pills. And so, not too often are people starting straight with heroin. It's usually something, that they had a real liking to some prescription meds. Okay, now we can go to the next slide. So fentanyl is something that, yes, it is prescription based. It is something that is used for pain management. Usually it's something that is for kind of those who are have terminally illnesses, serious medical conditions, And one of the things about fentanyl that it is 50 to 100 times stronger than morphine. So you have a really huge increase of overdoses related to use of fentanyl. So I really love this picture because if you could think about the tip of a pencil, that tiny bit of fentanyl is lethal. It's like a grain of salt or sand, and that could take you out. I have worked with individuals who were dealing with an opioid addiction, and they would talk about taking the fentanyl patches and chewing those to get a high. So it's really, really highly addictive, and it just takes a small amount. And so that's one of those things too, when you're responding or you think someone is having an overdose, and we'll talk about this a little further down, is that if you see white powdery substance when you're responding to someone who may have collapsed, you may need to stay away, because absorbing it through your skin or anything like that could put you at risk, and you having an overdose. And that's really important to make note of that too. And we could go to the next slide. So now the other thing that is out there is carfentanil, and that is 10,000 times stronger than morphine. So this image is really great because it shows the progression of like the little amount that you need to have a potential overdose. Carfentanil is something that is used for large animals such as elephants, like a tranquilizer, to calm them down. So it's not really meant for human consumption and human use. And again, looking at these images, it's really kind of mind-blowing to see this tiny amount of this substance that could really be harmful for you. And so we have another synthetic opioid. It's not as known. It's called Pink or U4. This started to come into our country in the 2000 teens, and then it was finally classified and scheduled as a drug, a Scheduled I drug. It is called pink because it is a pink powdery substance. And you can also find it in the capsule, so it almost looks like a Benadryl capsule. So that's the other thing to be careful about when you find pills around. If you don't know what it is, if it's not labeled, if it didn't come straight out of your prescription bottle, if it didn't come straight out of a package, don't take it. And so this has a similar impact in regards to like heroin and fentanyl. It's highly addictive. It does have overdoses. And it's really important to be mindful of these things, but it's the pink coloring that makes it different than some of the other fentanyl and heroin. So, oh, I may be skipping ahead. Well,
Yeah,
I
I got
think
you.
you're supposed to be doing this.
Yeah, I got you. Next slide. Awesome. All right. So I got a question. Have you ever been impacted by opioids? And this is going to be, it should be a little survey, and just click all, okay. Whether it's through
So we'll
yourself,
just raise a
family.
hands, yeah.
Yeah, that's cool. Community or workplace. All right.
Mhm.
Perfect. I see some people who are
Mhm.
responding to this. Okay. So can I ask, is there someone that would like to take a healthy risk and just share a little bit about how you've been impacted?
Mhm.
Anyone? No one wants to take a healthy risk?
Sorry, I'm trying to unmute here. Can you hear me?
Oh, yeah, Chinook, who's like take a healthy risk?
Yeah, sure. So
Okay.
I have an uncle in Gallup, and I'm assuming it might be opioids that's going on there, but yeah, it really devastated our community. gosh, there's so much to say, but they're like power lines were cut down by them. Dogs were killed by them, and yeah, they burned down their house. So
Mm.
yeah, it really devastated the family and community. So that was pretty wild. And that's all.
Mhm.
Well, thank you, Chinook. Thank you, Chinook, for sharing that and being vulnerable enough to share that with us here. Um, One of the things that, us working in this field is, again, being mindful of the resources, being mindful of the signs and symptoms that someone may be experiencing a opioid use disorder, right? And being able to offer that support or that connection to get them the support that they may need, right? Um, and this is where the community resources come into play. So you talked about Gallup. I'm familiar with Gallup. I actually have an office in Gallup, and I can connect you with some possible remedies to help your relative, if you would like. So just let me know, shoot me a text, and I can help you and point you in the right direction for that. Um, excuse me, but it's just another story that we hear in Indian country of how this disease is truly having such a impact on us, on our relatives. So again, thank you, Chinook, for being able to take that healthy risk. Um, Anyone else would like to share one more story?
Idella has her hand raised. Idella, did you have a comment? Maybe not. Might have been just her hand raised.
Okay. Everybody good? Okay. Um, so again, thank you, Chinook. And I just want to share something, personal as well. When I do these trainings, I'm really into this, right? Because this is part of my story. This is part of my journey. I myself and I consider myself to be surviving from the opioid epidemic, right? Um, I actually stopped drinking before I stopped using opioids. My last use of opioids was January 9th, 2018, and I have not picked up any substance since then, right? But it's had an impact. It had an impact on myself personally, physically. Um, my work was affected by it. My health was affected by it. My family was affected by it. My children were affected by it, right? And so now that I'm in recovery, I'm able to make my amends. I'm able to make my amends to my children, which I have. And now I have my boys, and we're doing amazing things together. And and the reason why I share that is for those that may have family members who are affected and going through the struggle of opioid use disorder, just know there is hope. Excuse me. Just know that there is a way. There is a way. See, our job is I can't keep anybody clean and sober. I can't do it. I don't have that power. But the power that I do have is being knowledgeable of the resources and being able to provide people the opportunity and option to get well. Right. And so, Chinook, I'm gonna connect with you, and I'm gonna be able to give you some resources that could possibly help your relative. And that's what I'm here to do. Right. And the more we learn about this, the more we verse ourselves with our resources, um, the more we can heal. Sarah, I see your hand up. Did you have a comment or a story?
Yeah, thank you for letting me share. I wasn't going to share, but I thought, well, maybe I should. I think it's a very an insidious problem because it opioids are just around everywhere and for around everyone, and you don't even think about it. I mean, I had a foot surgery, and I had heard about opioids and Narcan and all that work and all the things that the slippery slope that you can fall down. But I never thought it would come so close to my life. But when I had foot surgery, gosh, I mean, when you're in the opioids, the oxycodone that they gave me, wow, I thought I could do anything. I'm like, this is great. I could get up and walk around. And my husband was thankfully just said, no, you stay put, stay on the sofa. You're not going anywhere. You have a foot that's got, has been broken. And but I just, I just had this amazing feeling while I was on it. I thought, gosh, I can write an entire report, a book, everything. I can do all this wonderful thing. And it just really is such a lie. And when you're on it, you just think it's the most amazing thing. Everybody should have this feeling. But it's such a lie. And I even went as far as suggesting to the doctors that maybe I needed another bottle. And they were like, no. So there went that idea. But thankfully, but I came so close. I mean, you're just being exposed to it with doctors passing it out and blessings for the pain that it takes away. But you can come so close to danger with this problem. Thank you.
Oh my goodness. Thank you so much for sharing that, Sarah. And I can completely identify. And I think that's the danger, right? Is because of that euphoric feeling that you experience. That euphoric feeling that you experience. So then what happens, Sarah? So then you go from, because the doctor told you to only take one every 4 hours, one every 6 hours. But that feeling is so good. Ooh, I might slip in another one. I might slip in another pill maybe 2 hours after I took the first one, right?
Mhm.
And that's the danger. That's the danger because now I'm taking them, right, not as prescribed, and I'm having a physical reaction. My body's having a physical reaction to that, right? And that's when the addiction starts to creep in. So after 7 days of using opioids, right, especially not using them the way you were told to use them as prescribed, by 7 days you can be fully blown. You can be fully addicted. And that's where the danger comes in, right? So thank you for sharing that, Sarah. I
We
see a
have
couple of hands up. Deborah, did you want to? Okay.
Oh, no, I was just going to say we have 2 more hands raised. Yeah, thank you. Let's see, John or Danielle?
Hi, this is John, John Bird, and I'm from the Blackfeet Reservation in Montana. And I just wanted to say that there was an article in the New York Times about a year and a half ago or so that talked about how the um, the cartels have targeted the reservations, especially the big reservations on the northern plains, um, because they have a real problem with lack of law enforcement there. They just don't have enough police officers to cover all of the territory that are on those reservations there. And so the cartels have planted people in all of those reservations, and they just flooded the zone with fentanyl. Um, in the last year or a year and a half, maybe, I've lost 2 of my nephews to fentanyl overdoses. But it's just a really common thing in the community there that, now when I hear of a young person dying there, my first thought is it's either fentanyl or suicide. Um, and
Mhm.
so I just wanted to mention that, it's a real problem there because there just hasn't been enough. Yeah, and it's everywhere. It's one of the councilmen that they that they interviewed for the article said, the Blackfeet Reservation is just awash in fentanyl. It's everywhere, there. So it's very easy to get and it's pretty deadly. So that's all. Thank you.
No, thank you for sharing that, John. Honestly, you're absolutely right. Our tribes are definitely being targeted by the cartel, right? Um, I have a buddy of mine who I do some work with. We're co-facilitators in some trainings, but he used to, used to deal drugs, and he actually he told me, he's like, Moon, I used to work with the cartels, and we would travel all the way through all the pueblos, dropping it off because of exactly what you said, the lack of law enforcement. It was easy to get around, you know? So we're gonna keep on moving forward. I'm believe we can go to Danielle, had their hand up, and then Jamie, and then we'll continue on.
Okay, that sounds good. Can you all hear me okay?
Yes.
Okay, so from my end, I wanted to share something that's, having knowledge of both the sorrow and also a lot of good work that's being done in my community. So I live in the Central Coast of California, the lands of the Salinan and the Chumash. And as well as we have a lot of folks who are Central American Indigenous here. And on more the sorrow side, we've definitely seen methamphetamines and of course contaminated methamphetamines grow within our local community. Fentanyl has definitely reached us at this point. My sister lost her mother to fentanyl that was prescribed to her, and I lost the first love of my life to an opioid overdose. At the same time, here now in our area, we have so many people doing amazing work, wonderful treatment centers that are highly ranked within the state. We have an incredible addiction treatment studies program that actually focuses on bringing people in who are formerly incarcerated and in recovery to serve people because they don't want anyone else going through what they did. And I'm pleased to say that a loved one in my life used to struggle and has been clean from opioids for over 10 years now, and is actually now actively serving people in addiction who are in recovery.
Daniel, thank you so much for sharing that. And most importantly, thank you for so much for sharing your solution, right? That's what we need to hear more of is a solution. You know the problem, right? But it's a solution. So thank you so much for sharing that. And thank you, Jamie. I'm going to go ahead and move forward. So I'm going to pass it back over to Sienna.
Thank you. So one of the things that I like to do and kind of geek out about is looking at the trends of substance use, drugs that are coming through, and then also looking at overdose deaths. And we had 3 different waves that came through in regards to opioids and the deaths. And so we had the first wave that came in starting in the 1990s, and that's when opioids really first came on the scenes as a pain management. And doctors were really pushing it. There was like lots of flashy advertisement about it, and all the docs were prescribing it. And then our second wave came in around 2010 when you saw the rise of heroin. And also around that time, that's when they were starting to scale back and have a little bit more monitoring of opioids, prescription ones, and that's when some states wised up and they started to put in tracking systems, so then people weren't able to doctor shop. And then our third wave came in around 2013, and that's when you started to see a lot more synthetic opioids, fentanyl coming in. And fentanyl being in other substances that were being found on the street. So this is kind of like our waves that came through. And we'll go to the next slide. And so getting some of the facts and talking about some of the facts, it is one of the leading causes for injury-related causes of death in the US, and it really accelerated during COVID-19 pandemic. Kind of makes sense. People were isolated during that time. People were feeling depressed. People were panicked. So people were resorting to a substance that was making them feel better. Some of the data that came back for 2022 showed that we had just under 108,000 people die from a drug overdose, which kind of equals out to 295 overdoses each day. That's pretty staggering to think about that. And then in those overdoses, 76% of them were opioid related. And a lot of research showed that people who had at least one overdose more than likely had another. And that's also, looking at that and why. And then it's been estimated that 54.6 million Americans had a substance use disorder, needed treatment, but only about 13.1 million people actually received treatment. And that could be for a whole number of reasons. It could be lack of insurance, access, is there a provider that is close that is able to provide that treatment? What are the prevention models that are in place in the community? Or is the person even ready for treatment? So that's could be a whole reason why people were not receiving the treatment, even though there was a considerable high number of folks that needed it. If we could go to the next slide. So again, I like to look at the data, and the trends, and looking at things as they change. Even from year to year, you can see some changes that can be significant. So looking here at 2021, we had 220 people a day that was dealing with an opioid overdose. I'll go to the next slide. And then between 1999 and 2020, we saw about 263,000 Americans lost their lives, specifically to prescription opioid overdoses. And then in that same time frame, of the 263,000, 443,000 were to heroin. And then overdose deaths involving synthetic opioids in 2020, it was 18 times the number than in 2013. And so that's a staggering thing that occurred in a 7-year time frame, that we not doubled, but it became 18 times more in 7 years. So looking specifically in our communities and looking at the rates. And so opioid-related deaths among American Indian, Alaska Native from 15 to 64, that's a huge age range, but it's higher than any other racial group in the US. And some of our numbers sit at 1 in 10 of Alaska Native and American Indian age 12 and older used a prescription painkiller for non-medical reasons. And that's why it's really important to have these conversations with their youth, to let them know about the dangers and the risks that are involved. Also, it's really important as adults to not have these medicines easily accessible. Lock them up, put them away. They're not visible. A lot of youth will know to go to their elders and grab these different pills and utilize them. American Indian and Alaska Natives are twice as likely as the general population to become addicted to drugs and alcohol, and then 3 times as likely to die of a drug overdose. So these are really some staggering statistics. And so, yeah, we could go to the next slide. And then here's some really good data too, looking at the different breakdown of overdose deaths. And this is between the time frame of 2019, 2020. And we could go to the next slide. And as you can see, there has been a steady increase of the overdose deaths involving opioids in our communities from 2010 to 2020. And you see this really big spike that happened in 2020, and looking at that and correlating it with the pandemic. And again, we've just been in this really steady rise of opioid-related overdose and our mortality rates in our communities. And it's pretty high. Some folks put in the chat about experiencing overdose in the workplace and what that's looking like. And very often there's unintentional overdoses that are happening at work from non-medical use of drugs or alcohol. And that's about 5.8% of occupational injury deaths a year. And based on a survey that was conducted by the National Safety Council, 75% of employers report that opioid use has impacted their workplace, with 31% reporting an overdose, an arrest, a near miss, or an injury due to an opioid use. A lot of people sometimes, again, will get an injury at work or have a surgery, and will start off with a prescribed med. But then it kind of spirals out of that. We'll go to the next slide. A recent study reported that workplace injuries resulted in a loss of time. And that also, people being isolated showed an increase of suicide. And then also, engaging in the activity maybe a little bit more because they are isolated, they're trying to feel good, and overdose death. And then employers are reporting concerns about legal prescription opioid use, and then the misuse of the opioids. And only half reported that they were somewhat prepared to deal with it at the workplace. So a lot of employers don't have systems in place to support their employees if something does happen, policies and procedures. And those are all important things to look at. If you're a director, if you're leadership, how do we support our staff who may need the help in the workplace? A lot of these drug overdose deaths that do occur are in areas of transportation, warehouse, construction, but then also in our healthcare and social service areas. And I think that is important because a lot of us on the call today are sitting in that group of healthcare and social service sectors. And it's really important to make sure that we're taking care of ourselves.
Thank you, Sienna. So what can we do, y'all? What can we do? This is why I need you guys to start brainstorming a little bit, right? So some of the suggestions that we can do to either prevent opioid overdose or even help folks get through the opioid use disorder. Usually culturally appropriate practices. I'm a big advocate. I'm a big advocate of that, right? And the reason why I say that is because, just through some readings and some teachings, we were already given the medicine that we needed to get through this. Creator already gave us that, right? Our songs, our dances, our language, our traditions, all those things, right, were given to us to help combat this, right? Provided support groups. And this is something that you, as an individual, can begin to do in your own community. Tonight at 6 o'clock, I'm going to have a support group meeting for anyone and anyone all over the country, all walks of life. It's just a space. It's a safe space for people to come to share their experience, their strength, their hope, their shortcomings, their struggles, and be able to be supported by others within that circle. Getting connected, right? Linking people to care and recovery. Reducing the stigma. Right? There's a stigma attached to folks who are experiencing a substance use disorder. I've experienced that. Some of us may be guilty of using language that can be stigmatizing. Calling someone an addict or a junkie, as opposed to calling them by their first name and saying they're experiencing a substance use disorder, right? Making sure that we acknowledge that they are human and a person first can go a long way. Reducing the criminal aspect of that is associated with substance use disorder, opioid use disorder, right? Treatment first. Giving someone the opportunity to heal before we give them time. Working in an organization that I work for, we're huge advocates of that. We fight all the time to have folks that may have committed a crime, but their crime was connected to their addiction. Well, let's get to the root, right? Let's treat their addiction. Offering telehealth. Sometimes, especially working in rural communities, it may be difficult to bring people together or not. I work in a community as well to where they ask me to come and do a support group meeting for them. And so I go up there and I do a support group meeting for them. Providing that space, providing that opportunity. And these are things that you as an individual can either suggest in your community or you can create on your own. Next slide. So what responses has your community utilized, right? Trainings. Are you guys doing trainings in the community? Talking circles, awareness runs and walks, traditional medicines and practices, ceremonies, recovery programs, peer recovery programs. And you go ahead and fill me and put in the chat, is there anything in your community that you're seeing that either leadership or just individuals in your community, are they doing anything to respond to the crisis that's in your community? And I'll give you guys a few moments to do that. Like Danielle, you talked about the treatment centers that are coming up in your community and the different programming that's available and that actually being recognized about the amazing work that they're doing. Is there anyone else that's on the train that has also had these experiences within the community?
So Moon and Sienna, we have a comment from Adrian Tom in the chat. I think educating people on how to get clean and how Suboxone works and how long the withdrawal lasts, and then you throw in the sweat lodge and cultural practices. So that's something they're doing in their community.
Adrian, thank you so much for sharing that. That's actually going to tie into a slide later down the road about treatment, right? You mentioned Suboxone, MAT, medication-assisted treatment, right? Along with the lodge. Oh my goodness, that's crazy because in our presentation, that's exactly what the slide is going to show. So thank you. Thank you for sharing that. And it works. I'm a product of that. I'm a product of that. And so another aspect of that, a response that community has had is in Maine. And it was in regards to the Healing to Wellness courts. Is anybody familiar with Healing to Wellness courts? Do you guys have Healing to Wellness courts within your community? I see you, Adrian. Thank you. And so what we're going to do is next slide, we're going to share this video about the impact that Healing to Wellness courts can have within a community. Can we play the video?
I wasn't really in the community, especially while I was using the opiates, Percocet specifically. I had gotten so deep with them, I could just feel the stares on me when I was using, and I kind of lost it for a while with the culture.
Gabe Stewart lives on a small island reservation with 800 other members of the Penobscot Nation in the heart of Maine, a state hit hard by the opioid crisis.
All rise.
He spent the last year and a half in a special tribal court program that takes an unconventional approach to helping criminal drug offenders overcome addiction.
Good morning. We're on record in Penobscot Nation Wellness Court.
The Healing to Wellness Court is different from other drug courts. It was designed to meet the unique needs of the Penobscot Nation, which, like many Native American communities, struggles with issues related to substance abuse.
Most of the major crimes that are committed on the reserve involve substance use or abuse.
As with other drug courts, the Wellness Court gives offenders a path to having their charges dismissed, but it places special emphasis on reintegrating addicts back into their community by including them in Penobscot cultural practices and traditions.
When I first came in, we were wrestling with an Anglo-style court. People sat two tables, prosecutor sat at a table, public defender sat at a table. That's not relevant to the community. The circle is relevant to the community. We took the tables out, moved them aside, and had individuals sit in a circle. We started to include the participants speaking, and as you see, they have some of the most amazing insights to offer.
With every bump in the road that you've hit, your attitude has just been like perfect. If my attitude was just half as good as yours when I came in, I probably still wouldn't be here. I definitely still wouldn't be here.
So proud of you, and anytime you need anything, just ask, because we want to see you succeed. One of the ideas I had was to add the cultural and historic program. We've done basket making, sweetgrass picking, we host sweats.
Last night we had a sweat lodge ceremony.
Good to see you.
You too. I don't know if it was the heat mixed with like the drumming. I don't know why, but the drum, it just connects with me. I can feel it no matter how far away from it I am.
By doing things in the community, people see somebody actively engaged, and it kind of changes the perception that, you know, people can change.
While the opioid crisis has ravaged the country, rural Indigenous communities have been hit the hardest. Between 1999 and 2015, overdose deaths for rural Native Americans have increased more than 500%, compared to a 211% increase nationally.
We all know that there's trauma underlying why this is happening and why these behaviors are coming out. There's historical and there's personal.
I went from using maybe once or twice throughout the week to roughly every day, which became multiple times a day. I had to turn somewhere for money that I didn't have. My grandparents, I was actually pretty much stealing most of what I stole from them. They decided that enough was enough and that they needed to press charges.
When people are struggling with addiction, they have these crimes, there's this perception within the community of not maybe being welcomed or part of it, and nobody should have to feel like that.
More than 100 wellness courts operate in tribes across 26 states that use Native practices to help people with addiction make a cultural recovery, which can be more effective than traditional treatment alone. In the Penobscot Court, if a participant successfully completes the intensive program, their criminal cases are dismissed.
When Gabe first came in, he was one of those individuals who wore the hoodie up, head down. I go, please remove your hood. Oh my God. And there'd be times where he wouldn't even speak.
I pushed back definitely with the meetings with them. That was one of my biggest problems. So like their support and their acceptance of all of the stuff that I was going through, and the fact that no matter how pissed off I got at them, they still stayed by my side. I haven't had a lot of that in my life.
Individuals who are in the throes of addiction often feel alienated. The community doesn't want them anymore. As they start to rebuild that community, individuals start to feel like they belong again.
As his mother, of all the accomplishments I've seen him go through, this is my proudest moment.
It makes me so happy to see that you've stepped back up into your place in the community. You didn't go backwards, you kept going forward, and I'm very proud.
At Penobscot, we've been running this program for 5 years. We've only had one person end up back in jail. Now, we've had some people fail out, but if they complete this program, they're not likely to end up back in jail. I think we have one thing we have to do from a legal perspective.
Your Honor, the nation at this time would like to file a written motion to dismiss the charges against Gabe.
Court withdraws a guilty plea. Is there any objection to the motion to dismiss?
No objection.
The matters are all dismissed, and it gives me great pleasure to do so. Congratulations.
Everybody in the community can see the difference in me. I feel like I'm a part of the whole, not so much just alone in the world.
I'm gonna share something with y'all. When I first seen that video, I cried. Crying out. And it's because I started my sobriety journey, my recovery journey through drug court. It wasn't a healing to wellness court. It was through drug court, but it saved my life. And so for those who are maybe working with the drug courts, healing to wellness courts, who have an influence, I encourage you to continue, because they do work. They do work. So yeah, that video always hits me, man. A judge went so far to go into ceremony with a participant. Going into ceremony with a participant as a judge. How powerful is that? Right? So, supportive responses. Chinook, you're going to be familiar with this one. Mental health first aid training, right? mental health first aid training. I'm also facilitator of mental health first aid training. I highly recommend it being used in your community, right? But they use this program called ALGE, right? Assist for risk of suicidal harm, listening non-judgmentally, giving reassurance and information, encouraging appropriate professional help, and encourage self-help and other support strategies. I want to share this quick story, right? I'm not going to take too much time, but we just did a mental health first aid training back in my own community, back in Shinnecock, back in January, right? And I'm not gonna lie, I was a little timid. I was a little scared. I'm like, oh, I'm going back into my community. People know Moon, what Moon's done, what Moon is doing. Are they gonna even listen to me? Are they gonna be receptive? You know, how is it gonna be taken? And let me tell y'all something. It was received so well. We've had people, we had elders in that training. We had young people in that training. We had adults in that training. And the response and the actual conversations that were had, it did something for my community. And what it did is it created a spark. Ideas started to flow. So much so that the participants of that mental health first aid training came together a week later and said, we need to bring community back. Elders aren't talking to youth. Youth don't even know who the elders are. Where's our community? And so what we did is we came back together and we decided every single month we're going to do some kind of community event to provide the opportunity and option for people to come together and have community. So March 22nd, we organized a beach cleanup day to be followed by a talking circle, to be followed by a feed. See, the only thing we can do is provide the space and the opportunity, right? But consistency, for us to consistently do it, I think is going to have a huge impact. So I'm super excited to see that happen. Next slide. All right, responses, excuse me, to overdoses. Naloxone keeps the circle strong. Naloxone, can somebody tell me what it is? Adrian, I need you to help me out, my man. Adrian, can you tell me what naloxone is?
Yeah, naloxone, that's like Suboxone, right? Same stuff. Suboxone.
Different.
Naloxone's the nose spray.
Yeah.
Right? Yeah. So naloxone is what it does is it cuts the receptors off from your brain for overdose. And you could watch. We watched a video. We started training on this with our health clinic. Our substance abuse director did it where she showed us a video of this cop that just was reaching around a car, and carfentanil is so on a microgram level it just could be in the air, and you could overdose on it. And this cop had to take like 20 Narcans to survive. And lucky his buddies were there, but you could take multiple of them. It depends on how severe your overdose reaction is. And what it does, it cuts the receptors off from your brain for the overdose reaction.
Yeah. Thank you, Adrian. I appreciate you sharing that, man. Shamika, you said it saves lives. That's the point. It saves lives, right? But you're all right. What it does is that it's an antagonist. So when that is sprayed into either through your nose, it can be sprayed through your eye, right here in the corner of your eye. It can also be, injected through the rectum as well, right? I know it sounds gross, but it actually has happened and actually saves lives because these are canals directly to your bloodstream, right? And so when the naloxone, hits the brain, hits the bloodstream, it's going to knock off the opioid from your brain receptor. But what it does not do, it does not take the opioid out of your body. So if someone had a good night and they have a lot of opioids in their system, they might come to, right? But naloxone's only going to be there, it could wear off between 30 and 90 minutes. So if it wears off, that person can't go back into an overdose, right?
Yeah, that's what we learned, that they have to get medical help. It doesn't cure them. It just keeps them cool for those minutes, and they got to get medical help because that opioid's still in there and they'll die from it if they don't.
Exactly. Thank you for sharing that, man. Absolutely. You're absolutely right, bro. Thank you for sharing that. So I just want to share a little bit about naloxone here. Can we go to the next slide? Okay, so what do you know about someone who's experiencing an overdose? What are some of the signs and symptoms that you're familiar with that someone could be experiencing an overdose? And you guys can just yell it out.
Non-responsive.
Probably one of the most easiest ones to recognize is someone being unresponsive. Thank you. Anything
They could
else?
be snoring.
Yeah,
Snoring really
you ever
good,
heard of that?
dying.
Yeah, it's almost like what they call a death rattle,
Yes, yes.
right? That gurgling sound, right?
Yeah.
An absolute sign they could be experiencing an overdose. Absolutely. Anything else? The irregular breathing, right? Gray or blue or pale.
Shaking, vomiting, sweating,
Mhm.
clammy, cold skin.
Absolutely.
What they tell us to do is to like, you got to do the chest rub with your knuckles. Do a chest rub, and if they don't react from that, then something's going on.
Something's going on.
Do that, yeah,
Exactly.
chest rub.
Exactly. And we don't know. That's the thing, you guys, is we don't know. So, Adrian, you made a great point. You said you need to get them help ASAP, right? We need to get them help ASAP. So if you see someone, excuse me, that could be experiencing an overdose, you better hop on that horn, right? Calling 911 because we don't know what they're experiencing. Because what if you use Narcan and they didn't come to, and you use the max amount, which is suggested to be 3 Narcans, right? Which is going to be equivalent to 12 mLs, but your body can really only absorb about 10. Right? So if they don't come to, maybe they're experiencing something else. Maybe they're experiencing another medical condition, right? But believe me, Narcan is not going to harm them, right? Narcan can be used across a lifespan, from toddler to elder, even someone that may be pregnant, right? That's how safe it is, right? So don't be afraid to use it. And if it's not, excuse me, if they're not experiencing an opioid overdose, it's not going to harm them, but at least you tried, right? So that's the importance about calling 911. Because if they don't wake up and they're experiencing something else, you're going to have the right professionals there to assist. So thank you. Thank you for all you guys' responses. Next slide.
We've got a comment or question in the chat in responding to someone about rolling them over on their side.
Yeah, we're actually going to get there. Absolutely. So what that is called, Sarah, that is called the recovery position, right? It's preferably they say to roll them to the left side, and it's in regards because if someone, if a woman particularly is pregnant, I believe the baby is going to be safer when someone is laid on the left side, right? But that is called the recovery position. And this is a great segue into rescue breathing and mouth to mouth, right? Because rescue breathing itself, right, can save someone's life. It could save someone's life, and you might not even have to use Narcan, because when someone is experiencing an opioid overdose, that means they're not getting oxygen to their brain, right? An opioid is a depressant, which means it's going to slow down your respiratory system, right? Which means little oxygen is getting to your brain. So if you're comfortable enough, right, and it doesn't go against your cultural traditional ways, rescue breathing can be an instant survival mechanism. You can instantly save someone's life because you're providing the oxygen that their body is lacking, right? But say you weren't comfortable with that. That's okay. Because Sarah, like you just asked, excuse me, like you just asked, you can totally roll them over to recovery position, preventing them from vomiting on themselves. That's also saving someone's life. And then calling 911, right? And then calling 911. So these are all things that are life-saving techniques. Next slide. Okay, so Adrian, I want to come back to you. So I've seen one of your comments, and I've seen one of your comments about how in your community you're promoting to have Narcan within every household, right?
Yeah.
Which I think is amazing. And from my understanding, I believe it's called Narcan saturation, right? There's a whole training about this, right? Where every single household is going to have Narcan within their home, right? And I applaud you for your community doing that, because these are all practices that are absolutely going to save lives. So I hope that you are familiar with how you can get Narcan. And
Yeah.
hopefully you're familiar with how to get Narcan and not having to pay for it, because it is costly. Chinook, you're on here. You have a resource. Maybe we have relatives here in New Mexico that are in need of Narcan, right? Albuquerque Area Indian Health Board and the CHIRP program and the SO team provide Narcan to communities. Did you want to elaborate on that?
Yes, and as far as my knowledge, I believe you don't even have to be in New Mexico. So you could fill out a request form and we can send that out to you.
Nice. And I think Chinook put the CHIRP link into the chat. So hit up Chinook and the CHIRP team and they'll get you guys some Narcan.
Thank you.
Yep. Thank you for sharing that, because it is a little hefty when you go to Walgreens. I'm telling you that right now.
Yeah.
Next slide, please. All right, y'all. So let's talk about how do we even prevent this from even happening, right? Prevention before the cure. Prevention before the cure. Working with our young folks. You know, we talked about these amazing community events that brings community together. That's a prevention tool. See, the opposite of addiction is connection. So when I'm feeling connected, when I'm feeling a part of, I'm going to feel less likely to use. Right? When I'm feeling part of my family, my community, my relatives, when I'm creating my circle around people who are doing the right thing and who are not using substances, right? I'm a big advocate of sports, and I'm a big advocate, excuse me, of cultural ways. And I'm saying that because I've seen it work for my own children. I have 3 teenage boys. I'm actually driving back to New York Friday to get my son set up back in New York, right? But I'm going to tell you something. My boys have been a part of their culture, have been extremely instrumental in their societies here in New Mexico since they were 1 and 2 years old. They have since been able to go back to my home in Shinnecock and participate in their coming of age ceremony, which is just added on to them feeling a part of, both here in New Mexico, where they come from, Jemez and Cochiti, and back home in Shinnecock. See, we did that intentionally because we know culture was going to be a big part of their survival here in this world, as well as sports. Yesterday, my youngest son just started playing lacrosse, and I'm about to cry because I'm in this for real. My son just started playing lacrosse, our medicine game from back in the Northeast. Never played a day in his life. He put them pads on, just went out, and he likes it. See, I have to do this. I have to keep my boys active and feel supported and feeling a part of, because I just told you the opposite of addiction is connection. Right? So all these things work, y'all. All these things work. It's our job. We're the adults. We're the elders in some of these people's. We're that trusted adult when it comes to our youth. We're that trusted adult. They're looking at us. Right? It's our job to make sure we're there with open arms. Next slide. So, my man Adrian, you hit it already. You already told me this slide. I don't know what's going on. If you got a sneak peek at the slide or what, bro. But you told me this, right? You talked about Suboxone. You talked about medication-assisted treatment. Absolutely. Suboxone is a way for someone to get off of opioids, right? Taper down. Taper down. Taper down. And then what you say, throw them in that lodge. Throw them into ceremony. Surround them back with their culture. Give them that opportunity to do so.
Yeah.
Give them that opportunity to do so. Because see, not everyone is into their culture. And that's okay. I'm not here to say that's a good thing or a bad thing. My job, again, is to provide the opportunity.
Yeah.
Right? And so working, we look at this as Western medicine and our medicine.
Yeah.
And I am an advocate of that. I am an advocate of using both of those to help our people, because it's hard. It's so hard. It's so hard to get off of this.
Yeah, definitely.
Yeah.
Yeah, through our grant now, the Native Connections Culture Equals Prevention, and when you think of this whole entire problem of opiates, our way of life was lost, through the colonization, of our continent here, and that our language, our land, our reproduction, and our ceremonies are all taken away. Now, when we go back to those ceremonies now with our Native Connections grant, culture does equal prevention. When I first worked on the first suicide prevention grant, which was like the GLS, and then also did the methamphetamine suicide prevention initiative, all those grants, it was just suicide prevention. Then no one knew what to do until they started going with the tribes. And now our culture for us is prevention. So bringing back our ways, sweat lodge, their ceremonies, it heals us. It heals us. Yeah. So when you think about substance abuse and all those chemicals inside you, when you sweat, all that comes out, and you feel good after you sweat and peer. Start doing that again. It'll really benefit our people and getting these sweat lodges going again. We have some in the area, just getting the leaders and them to go and the people to go to them is the problem. So we're trying to bridge that gap and get back to our ceremonies.
Well, keep going. Just keep doing it. Keep providing that opportunity and option, man. I'm a huge advocate of the sweat lodge as well, bro. Working at the treatment center, we got guys asking for it. So now it's my job. If they're asking for it, right? That's huge. Yeah. So now I got to provide that, right? And so I got a guy down here in Albuquerque. I got to do some transporting, you know what I'm saying? But that's nothing. Transportation, we got to make that happen. We can't let transportation be a barrier.
Yeah.
Do you know what I'm saying? But thank you, man. Thank you for sharing that. Next slide. And so I just want to share this teaching, right? This is the teaching that as I was going through my recovery process, my mom was instrumental in supporting me. Because she's seen it all. You know what I mean? And how devastating is it for a parent to see their offspring suffering. And so she sent me this teaching, which is this resonates with me, and I use it. I use it throughout my professional life, my professional career, but also just in everyday life. And it's called the Sacred Circle. And it says, when the Creator put us on this earth, He gave us 4 gifts to help us through the troubled times. The first was the gift of prayer. The second was the gift of sharing. The third was the gift of crying to wash away the pain. The fourth was the gift of laughter. If you can do these 4 things, it is said you went on a healing journey. And the reason why that is so powerful, it's because you think about it, right? When I work with individuals, or even when I'm doing a group, and I kind of point out, especially when someone is going through a hard time, I kind of point out what they're actually doing without them even knowing they're doing it. And what I mean by that is that if we're in a talking circle and someone opens up and they share, they shared, they already have 1 gift, right? And maybe they're sharing, and that sharing brings tears. Ooh, we're getting closer. Now they got 2 gifts. And maybe that person is being grateful, or maybe that person is asking for prayers, right? Ooh, now they got 3 gifts. And now, if I can get them to smile, if I can get them to smirk, if I can get them to giggle, we got 4 gifts. And then I can say and point that out to them, you're in a good place. You just did those 4 medicines. You're on a good healing journey. And when we can point that out to them, let me tell you right now, I see miracles happen. I see miracles happen, y'all. Next slide. So we got a few more moments. If anybody has any comments, any questions, if there's any questions in the chat that I missed, feel free to point them out. We can get those. We try to get those answered.
Mm-hmm. Hey, this is Deborah. We also have a QR code on here that we would like you to take a picture of. It is for feedback on the webinar, and we'd really like to hear, really like you to do that so we can get some really good reflections on how you enjoy, how you, what you learned from this webinar, and hopefully, and for future ones. We do have the webinar team that worked with Waylon to put this presentation together. We do have 2 new fact sheets that will be coming out. We were trying to time it to have them, ready by this webinar, but I'm sure they're going to be coming out within the next few weeks. We're almost finished with them, and that will be some really good follow-up information for everybody. So again, we'll be getting those out to you within the next few weeks. So if anybody would like to come off on mute and any final comments or questions to Waylon or Sienna, please feel free.
Thank you for sharing and presenting.
Thank you, Shana.
I have a question. So this is Dominique with Denver Indian Health and Family Services. We are a UIO, so we do, billing, and there's been a lot of talk of Medicaid starting to pick up traditional practices. It doesn't sound like it's reached Colorado yet, but what's a better way for us to advocate for that to reach Colorado? And how can we find out more information on starting those billing practices?
That's actually a very good question. I'm just going to share a little bit about my experience with that, because I'm in New Mexico and we are a state that is able to reimburse for those services, right? Though I don't have too much information about how to advocate for that, other than your local senator, right? Or whoever's in charge in there. But what I would suggest is, okay, I got a suggestion for you. So you're in Colorado, which means you have peer support workers, right?
Yeah.
Okay. So if you have peer support workers, right, or even you have case managers, would you be able to bill it as a peer support group or session, but that is going to include cultural practices? And the reason why I share that is because before New Mexico got approved to bill for traditional practices, before that, I did a talking circle, which was definitely culturally relevant, engaging. We use everything, right? But I billed it as a peer support group. So we got paid for that.
That's a great idea.
So use your peers. Definitely use the peers. I'm a peer. I'm advocating for peers right now. But that's a totally way to get around that for now until it reaches Colorado.
Awesome. Thank you.
Okay. We wanted to make sure that you have both Sienna and Waylon's contact information. So take a minute to jot down their emails or phone numbers, and later on, if you have questions or comments, again, please feel free to get hold of either one of them. And then I'm going to turn this back over to Waylon for closing in a good way. Thank you.
Yeah, so first and foremost, I just want to say to Bootnish, to each and every one of you, thank you, for being here today. And definitely hit us up. I'm open and willing to travel and come into your community and to help assist with groups or developing programming, whatever it is, trainings, mental health first aid trainings, whatever. I'm here to help. I'm truly into this and know that that it works. So the way that I like to end this is that I lost a lot of relatives to this disease. I lost my brother to this, opioids. And we can't forget them. We can't forget those that we have lost. And so what I'm going to do here is I'm gonna light this sage here. That was a gift given to me from a woman who I helped her son get into treatment almost 2 years ago. He has since been sober. She travels to Oklahoma to go and visit her daughter. And every time she goes to Oklahoma, she stops and she handpicks the sage and she comes back and she gives it to me. So I'm going to share this smoke with you, and my intention is to spread this good energy, this good medicine to your way, right? And hoping that this reaches your mind, because we're here to come together to have a good mind, right? To put our minds together as one, so we can take this medicine and this information that we learned and bring it back to our community. And then I'm going to share this song that I was taught to sing by my brother, Kenny Merrick Jr. He has since passed on, but he was instrumental to my family and to the songs that he had taught us. He came down when my brother passed away, and he told us to sing this memorial song. And it was to help the families through their healing journey, through their healing process. It is in the Lakota language, as he shared it with us. But the song is so beautiful that I'm going to share it. And I'm going to share it for everyone, for those that may have lost relatives, to this disease. This is our opportunity now to make sure that they're not forgotten. And I do this work. Because I truly believe everyone that I've lost to this disease is over in the spirit world, have a ceremony for me now, so I could do this work to help others. I'm a little under the weather, so excuse my voice. It's not going to be as crisp as I would like it to be. But here we go. Hey, I'll tell you about to get your money due. I say to boot this to each and every one of you. And thank you for taking your time out of your day to participate. And I hope you leave here feeling better than you did when you came.